When you talk about technological switch that brought about so much improvement in dental industry, that brings me always to my favorite question that I ask in every podcast is the AI question, the recent buzzword. So how big of a role does AI as of now play in dental industry?
AI is growing so fast in dentistry, and I have to say, I'm just so I love what I do because I work with the best doctor, and she is so involved in AI, and she absolutely loves it. Matter of fact, she was like written up as one of the top, AI, women, right? Women. She's a woman dentist. Dr. Cindy Rourke, I'll plug her out there. But she's so great at AI. And she has, went to school and learned all about it. And she's just so techy and so advanced. And I've had the honor to work with her. And, we've done lots of cool things with AI. There's, lots of AI technology now that will read x-rays. So the big thing for dentists is that if you put 10 dentists out, right, and you give them all the same x-ray, this is a proven study from Harvard, 7 of them are all going to say something different. Only 3 will be the same,
Hmm.
right?
Why is
Because,
that?
well, that's just because where you went to school. Are you going to watch it? Are you going to treat it? Right? Because there's all these different philosophies out there. Versus AI, where it's really bringing the dental community, is it's really looking at, AI takes millions and millions of pictures, right, of the mouth, and it keeps learning more and more. You understand AI.
Hmm.
So, it has a much more trained eye than, per se, than even a doctor who has just looked at 1,000 x-rays, right? Because AI's looked at way more than they have because it has the capabilities to see so much more. So it makes it pretty damn accurate, right? And it creates consistency, versus when you have all these doctors, because it's like, okay, check, that's okay, check, that's okay, right? Versus you have a couple doctors, well, that's kind of okay. That looks like we'll put a watch on it and we'll check it in 6 months and see what we're thinking. Or, how about this? Why don't I give you some topical fluoride? You can use that, and then I'm gonna send you home with this, and you use this every day. So, right, there's all these different philosophies too on how to treat it. Versus, AI really is going to lay it out like, hey, this is what's needed. And then the doctor can make the determination. They still have their own clinical judgment. But what I think that's really great about it is it's really creating consistency. Because, for me, the big thing with hygiene is periodontal disease. That's what hygienists treat is periodontal disease, which is the disease of the gums, the bone, the supporting structures. Everything below the teeth. That's really hygiene. But the biggest part was bone loss, right? So bone loss, hygienists, we do everything underneath the gums, which is the supporting structures. And the great thing about it is we always use the question, like, is that bone loss? Or you have one doctor say, oh, that's not, because a lot of it's based on 20% of bone loss, 30% of bone loss, right? Like, and then that's how you move up the chart, right? The more bone loss, the more severe your disease is. And so between 20% or 40%, right? That's kind of subjective. If you and I are looking at something, it's going to be subjective versus AI is not as subjective. And so I think it just really creates that consistency and allows us then to identify also early curious lesions versus before we really weren't paying that attention to them because they're not, something's kind of decaying. It's like the shade on an x-ray, right? So the darker it is, the more decayed it is. Makes sense?
Got it.
But it shades. So you may see a shade a different way than I see a shade. Kind of, are you following me? Versus
Mhm.
AI is going to pick up that like and nail it every single time. And so it allows us to treat these earlier because it's going to notice the shading and variation in the tooth structure earlier than you can see with the naked eye.
Got it. So you say, especially in dental industry, AI is making significant progress in the right way.
Significant. Oh goodness. And I think it's just going to keep changing constantly. I mean, there's also like AI for auto charting. So that helps out, like, where we can take your x-rays and automatically chart it for you versus, somebody going by hand and drawing it out or putting it in the computer. We automatically chart it based on what's in the x-rays. The one thing that we don't have that maybe one day will, and that's a really hard thing to come up with, is how you do that part where I said the hygienist should be probing and walking and taking those measurements. We don't have a good way to do that yet. And if we could really figure out a good way to do that, man, we could almost just AI it through diagnosis, and then you have to have a person there. But you have to have a doctor approve it and make sure they're in. But it would create a lot of consistency, and you could reach a lot of people. For instance, like teledentistry too. If you had it, like, you could create like an app or something that could use AI, and then tell the person like how their mouth is, right? They have any areas of concern. And I've worked on a project like that. It's going to launch here soon in the US, and they keep changing its name, so I don't even know what they need to call it. But really cool technology, and it really can be with an iPhone, or a smartphone. I have an iPhone. I'm an iPhone user, not me. But if you just literally take it and you can scan, and then it'll tell you like, this is an area of concern, this area is like an emergency, this is a decayed area, you need immediate attention, or hey, this is an area of health, right? That technology's coming. It's just really cool to see it. And like I said, I really have this really amazing opportunity that I get to be one of the first people that ever sees it because I get to work, at a place that is so technology savvy, that is just super impressive. I know you got to get to one of my practices in Tampa.
Oh yeah, for sure. That's amazing. Wow.